Hi, this is Jeff Zeig, and here I am in Phoenix, Arizona at the offices of the Milton Erickson Foundation. This series is Stories with Milton Erickson. When I visited Dr. Erickson in 1973, he was working with a patient who in some circles would have been diagnosed as somebody having a serious mental disorder. This man, we'll call him John, was the only child of wealthy, established Phoenix residents, and the tension between the parents and the son grew. The son was able to maintain a job, but pretty soon this mental health problem became so fulminant in his life that he couldn't maintain a job, and even driving became difficult. So Dr. Erickson took on this patient, and he had been hospitalized in one of the major teaching institutions on the East Coast. And one of the things that Dr. Erickson tried to do was to redefine the problem as being an acute hysterical psychosis and not a major mental illness. Now, one of the initial interventions was to get the client to be interested in having a dog. Now, the client wasn't especially interested at first, but Dr. Erickson interested him in getting a dog. Mrs. Erickson helped John to get an apartment that was proximate to the Erickson home, because really the Erickson family was the primary social contact that John had. And John could no longer drive, so he could walk to the Erickson home. Now, one of the things that we know about psychiatric patients is they tend not to be very responsible about their appointments. You make an appointment for 8 in the morning, they show up at 8 at night, and one of the problems is compliance with treatment. So Dr. Erickson was successful at getting John to be interested in having a dog. Now, where are you going to find a dog? Well, you're not going to get a pedigree dog, so Dr. Erickson, one of Dr. Erickson's daughters, I believe Christy, took John to the dog pound, which is an institution for chronic dogs who are awaiting their final injection. And John walked in, saw a beagle, and adopted the beagle, who was called Barney. Now, the therapy then centered around tangential communication, which is also something that's very familiar to psychiatric patients, communicating tangentially. And at first, Barney stayed with John, but after a while it became impossible to maintain Barney at John's small apartment, so they had to think and think and think, where could they keep the dog? Oh, they would keep it at Dr. Erickson's home, but it wasn't going to be the Erickson family dog, it was John's dog, so he would have to come over twice a day to feed and tend for the dog. And then the therapy started to happen around the dog. So John would come over from 8 o'clock to 10 o'clock at night, watch television with Dr. and Mrs. Erickson. And Barney, if he came near Dr. Erickson had a horn, a bicycle horn attached to his wheelchair. He would beep the horn. He had a fly swatter. He would shoo at the dog with the fly swatter, speak to the dog gruffly, John's dog. And Barney started to become fearful of Dr. Erickson. Now, Dr. Erickson, who didn't have very good use of his hands, would take a plier, and he would break dog biscuits into two, needing to use a plier to do it. He would give half of the dog biscuit to John, who would give half of the dog biscuit to Barney. And this was reinforcing the relationship between John and Barney. Then there was a series of limericks. It was a Christmas gift. It was a little booklet of limericks written by the old codger, what Barney referred to as Dr. Erickson. Mrs. Erickson was the lady of the house. And these limericks were teasing about paranoia. An example of one of the limericks, the old codger's table creaks, there follow those wheelchair squeaks. From his haven, very craven, alert Barney all tiptoes retreats. And then there were poems and letters that Barney would write to John. Remember that some psychiatric patients communicate tangentially, so Dr. Erickson was harnessing tangential communication. There was one letter that was written from Barney to Barney, and it was about a story. And Mrs. Erickson and son Robert were telling a story, and they said, well, please don't tell that story to you-know-who, meaning John. And it was a story about an old codger. And the old codger advertises for a wife. And the wife comes by train, and the old codger picks her up with 2 saddle horses. As they're going to the old codger's cabin, the horse stumbles. The old codger says, 1. The horse stumbles again a little while later. The old codger says, 2. A third time the horse stumbles. The old codger says, 3, gets off the horse, takes out his gun, shoots the horse dead. The wife-to-be says, that's outrageous to shoot a horse just for stumbling. The old codger just says, 1. And Erickson and Barney are communicating about why shouldn't anyone be able to hear that story. And Dr. Erickson had this way of writing longer poems about the adventures of Barney. And in this process, he was deflating the old codger, who was Dr. Erickson, and elevating the lady of the house. Now, Barney was a medical wonder. He had disseminated valley fever, which is a fungal disease that is common to residents and, I guess, dogs who live in Arizona. Most of us get that in a very mild version and then overcome it. But Barney had to be kept alive, and there were many trips to the vets, and the Erickson family spent a lot to keep Barney alive. Dr. Erickson separated John from his parents, and John was able to get a stipend from which to live, and Dr. Erickson got a small stipend for supplying the treatment, but the tension between the parents and John were so great that it just couldn't be bridged. And in March of 1979, March of 1980, Dr. Erickson passed away, and not too long thereafter, Barney died. And Mrs. Erickson and John went to the pound, and they found 2 dogs, one named Barnabas and one named Angelique, both from the same litter, but very different dogs. And then John had a function, and he became a kind of protector for the dogs and a protector for Mrs. Erickson. Now, in any drama, there are 3 roles. There's a persecutor, there's a victim, and there's a rescuer. And Erickson occupied the role of being the persecutor to Barney. And Barney was the victim of Dr. Erickson's terrorizing the poor dog. Now, that only left one role for John. And there was a functional role of John being a protector. And then this role just spread so that when Dr. Erickson died, John could continue to be a protector and stay out of being interned in hospitals and have some meaning in his life. And as it turned out, he was able to graduate from the Erickson family and establish his own independent existence in life. So this was brief therapy, but it wasn't short term. It was focused therapy, as if the therapy was focused over the course of a lifespan. It was an uncommon therapy, a brief intermittent therapy. It was a therapy that involved tasks that in this case involved a dog, as a way of communicating and helping somebody to build their self-esteem around the things that they did and could learn to do and could learn to do well. This is Jeff Zeig. Here I am in Phoenix, Arizona. More Erickson stories to come. Thank you so much.